Welcome to the training on safe injection practices. Ensuring the safety of healthcare staff and patients is our top priority. Let's discuss the essential steps for safe injections. A safe injection involves no harm to the patient, no avoidable risk to the provider, no danger to others due to waste generated during healthcare. The goal of safe injection practices is to promote safe techniques during medical procedures, especially when administering the following types of injections: intradermal, subcutaneous, intramuscular, and intravenous infusion. Hand hygiene is crucial, especially before and after administering injections, before starting an injection session, before direct contact with patients, after direct contact and after removing gloves. Use of gloves during injections. If both the healthcare providers and the patient's skin are intact, gloves are not necessary for routine intradermal, subcutaneous, or intramuscular injections. However, gloves are essential when there is a risk of contact with blood or potentially infectious materials. Use of personal protective equipment, or PPE. Masks, eye protection, and other protective clothing are necessary only when blood splashes are anticipated or when there is a risk of exposure to infectious patients or materials. Single-use PPE should be disposed of immediately after use. Preparing the skin with antiseptic for injections. Prepare the skin with a single-use swab containing 60 to 70% alcohol solution. Clean from the center outwards without returning to the starting point. Apply the solution for 30 seconds and allow it to dry completely. Injection devices and practical guidance. Use a sterile, single-use syringe or device for each procedure. Check the packaging for any damage or expiration. Strictly adhere to the policy of one syringe, one patient. Discarding multi-dose vials. Discard multi-dose vials if sterility is compromised, the expiration date has passed, or they are not stored correctly after opening. Preparation and collection of injection supplies. Prepare injections in a clean and designated area. Gather all necessary sterile single-use needles and syringes, alcohol swabs, and sharps containers. Alright, so let's move on to preparation and labeling. It's important to label the final medication vials with both the preparation and expiration dates. And don't forget to include the name and signature of the person preparing it. This step ensures that everything is traceable and safe for use. Injection administration and precautions. Follow aseptic techniques for all injections. Verify the medication chart with the patient's name and dosage. Open the syringe package in front of the patient. Prevention of needle stick or sharp injuries and disposal of sharps. Avoid recapping needles. Dispose of used sharps immediately in a puncture-proof container. Keep sharps containers within arm's reach and replace them when they are 3/4 full. Engineering controls and work practices. Use needle safety devices and maintain hand hygiene. Ensure safe management of sharps to reduce the risk of blood-borne pathogens. Personal protective equipment, PPE. Use appropriate PPE, such as gloves, gowns, and eye protection to prevent exposure to blood-borne pathogens. Thank you for attending this training on safe injection practices. By following these guidelines, we can ensure the safety and well-being of both healthcare staff and patients.